Bridget is worked up, so let's hear her rant.
I am worked up because I guess it's a slip. Is it a slip? So the coronavirus, I've always been obsessed with pandemics.
Yes.
Just in general. We have our apocalypse fixation, but pandemics is something I've studied. I've always read about it. I always figured I'd live through one because the chances are high.
Mm-hmm.
And we're such a global village now with everybody going here, there, and everywhere. So it's something I've always been really fascinated with. And then just the domino effect ramifications that you don't think about.
Mm-hmm.
You know, just like the wedding. Do you have a wedding? Who, like Jacob, who's 92, had lost a friend, and there's a memorial this Friday. Does he go? He's asking himself whether or not he goes. So little minute decisions like that people have to make.
Mm-hmm.
And I've been off Twitter for Lent, but during all of this stuff, you know, I'm kind of watching it unfold, and I'm like, I asked myself the question is, you hear a lot of people saying, this is just hysteria. This is just panic. Everybody calm down. And so I ask myself, is this hysteria? And the only way to get to the bottom of that question for me is to go to experts, because I don't trust mainstream media. I don't trust pundits who are embarrassing themselves. And we'll get back to that later. This is I'm embarrassed for most of the right-wing pundits right now. It is embarrassing, the things that they are saying. And Ted Cruz today said something asinine. Like, it is embarrassing what these people are saying and the misinformation that they're spreading and the way that they're trying to act like this is something that's political when it's not.
Yeah.
It's just beyond. I am embarrassed for everybody.
You can't spin a virus.
No.
Eventually it catches up with you.
Yeah. And you can try all you want. In the meantime, you're just all of the fighting over whether, and again, left and right, like the left being like, stop calling it Wuhan virus. It's racist. And the right being like, no, it's not actually racist. Who fucking cares? You people are wasting time yelling at each other about this. You're ridiculous. You should be helping your community get prepared locally for what you do. Do you actually, okay, fine, don't panic. Can you answer the question, what do I do if someone that I love comes home and says, I don't feel well and I have a cough? Do you know how to answer that question for yourself or for anyone in your community? Because if you don't, go fuck yourself. You don't know anything and you're not prepared. You're actually not prepared at all, and you've been sitting online bitching about how this is a panic, when meanwhile, people don't know where to go get tested. They don't know what to do in the event that somebody they love is in a nursing home that goes on shutdown. They're not checking on their elderly and telling them what to do. They're going about business as usual. Their kids are all little hosts. This virus, there was a study that came out today. The virus can live on surfaces for 3 days.
Holy shit.
Yeah. And can live in the air for 7 hours. It is no joke. And then once it incubates, you don't even see it for days.
And you're highly contagious.
And you're more contagious in the beginning than you are once it actually sets in. It's a little bastard, this thing. And everyone's acting like, so anyway, I went down this deep dive and I read blogs from people from a Chinese doctor. She was the one who actually, like, Dr. Lee, the one who died, they say that he was the whistleblower, but she gave him the whistle. She was like the doctor who was in the ER who saw all of these deaths and was like, something's not right. And had a blog that keeps getting taken down in China, but then somebody posted it. And so I was reading her blog, and then I've been reading things translated from Italian into English from the front lines and trying to find local sources for all of the information. And this shit is gnarly. And to think that it's not going to behave the same way in the United States that it does in literally every other country that it goes to is arrogant at best. And we are not prepared.
No.
Our system is not prepared.
No.
And then there was a really interesting thread about how they think, you know, people in America, particularly boomers, have this like old school idea of China being like a third world country. And they're more prepared, because they've experienced, you know, like swine flu and the avian bird flu. They like all of the pandemics come out of there, it seems like. and they are more accustomed to dealing with this kind of containment.
Right.
They're also a dictatorship, so they can mobilize an entire country, and they have a people who are more compliant and not idiots like the people I see online in America who are literally fucking morons.
They can build a hospital in 10 days. Can we do that? Absolutely not.
They also make all the medical equipment
and all of the medicines we rely on.
And so they had that stuff in abundance, and they were more prepared than anyone, and their hospital in Wuhan still got overwhelmed. Now, the other thing that I've learned and that I've become obsessed with is this idea of flattening the curve, which is that in any pandemic, once that exponential growth starts happening, you have a window where generally with social distancing and like being overly diligent about washing your hands and surfaces, you can reduce the amount of people that end up in the healthcare system. And that's what we're trying to do right now. Now, not once the healthcare system starts getting overwhelmed. It's too late. Everything we're doing right now is to stop the spread of the virus because we've lost the ability to track it. So there are different phases in a pandemic. I watched the whole World Health Organization. Like, I've been just paying attention because I was curious, like, is this something that people are getting hysterical about, or is it something that we definitely are not taking seriously enough in America? And judging that most Americans are morons, I generally err on the side that we are not taking it seriously enough. And the interesting thing about prevention is that you never know when it works because it works.
Right.
So everyone, there was a great quote that was going around that at the beginning, before a pandemic, everything seems alarmist. And after one, nothing, it seems like nothing, there wasn't enough done.
Yeah.
And so if we're doing things now that are preventative, like canceling these parades, great. We're actually taking action now. It might already be we lost 3 weeks. We had bad testing. We've lost a lot of time. It might be too late. We can't, they were saying today on Who, there are countries that don't have this, and they should be trying to keep it that way. So he was saying, in most pandemics, we don't have the ability to control what the outcome or to flatten the curve, which is reducing the number of people. So we're trying essentially to spread out the number of people who need help. It's not like people aren't going to get it. We'll probably all be exposed at some point or another. And they were saying this is a pandemic that will become endemic like the flu. So it's like we'll have coronavirus season where people get it and die.
Right.
But we'll be better prepared and our immunities will build up. We also have an entire global population that has zero immunity to this. So the first time it sweeps through, it will be bad. But even in the event of like the Black Plague, it was like the third wave that killed more people. The thing, it gets stronger the more it evolves and changes with every kind of round that it goes through. And they don't know really that much about it. They're just learning. And there was a whole great thread that somebody did about the pluses and minuses of the first pandemic that's in the age of social media. One of the benefits is that doctors can share information, what they're learning. They have Who has a real time, like an AI tracking in real time instances and information that it collects over like who has the virus and where, and not even just the coronavirus, all different kinds of viruses and flus. And they were saying, but misinformation spreads like crazy. And then there are the bad actors and people who will try and capitalize on, like right today I was reading there's a malware, it's a like malicious program that is supposedly tracking numbers in real time from Johns Hopkins. And it's really just like a Trojan horse to hack your computer. Jesus. So then there's that.
Right.
And they were saying that there are all these, but doctors are able to like peer review each other much more quickly and say like, well, we're seeing this over here. And so that's happening faster than ever. And
well, okay, since you have so much information, what should people do if someone comes home with a cough and is like, I don't feel good?
It depends on It depends on where they live and on the region. So generally, don't go to the ER unless you're having trouble breathing. Don't go to the ER. Try and find a place. They're starting to do drive-through tests in certain parts of America. It again depends on where you are. We're only testing like 4,000 people a day though, and it's still it completely depends on where you live. And in the instance of like this is where teledocking is your best friend. And
What's
it might
teledocking?
So teledoc is like how when I'm traveling I'll use it.
Oh, a doctor
most like if you're with Blue Shield, teledoc is a service that you have access to. But most even like my hospital, another thing to do would be to call your primary care provider. And if you can't call them, generally I would say in like our instance, our primary care provider sent us an email,
right? And
it said exactly here's what to do. You know, if you are thinking that you have coronavirus, if you've been exposed to someone you know who has it, you definitely should self-quarantine, and then you call where your primary care provider or an ER or whatever the local protocol is for you in this situation. And then they'll tell you they have to get ready for you to come. It's like if you have measles, they have to basically quarantine you because it's so contagious, and they can't. The reason they tell you not to go to the ER is if you think it is that 50% during things like this, 50% of the transmission happens when people are sitting around waiting in ERs.
Right.
So they don't want everybody who thinks they have it or who might not have it going to an ER and then waiting and getting it.
Right.
And if you do have it, they have special procedures for trying to take you in or to test you. But again, it completely depends on where you are. Like in Seattle, they have drive-through testing now where it's like they're testing 1 million people in South Korea, and a lot of it is just drive-through. So you don't even have to get out of the car and expose people to you. I'm not sure exactly you just really should look into it locally for what you should do, and everybody should know what to do, because there is a potential that someone you know or love could get sick. And if you start looking online at what's happening with people even in the United States and really start going down that rabbit hole, you'll start seeing people on Twitter talking about their horror stories of being sick, being at a conference where somebody got sick and now they're sick, but them and their husband are quarantined in a hospital, and there's all this misinformation, and the institutions don't even know what to do. So the more information that you can arm yourself with in advance, the better, and the less you will stress these resources when people do start getting sick, because they're not going to have time to answer all your stupid questions. You should already have as many answers that you can possibly have. Like, we have time right now. We still have time. And in that time, people should be, and again, I'm not saying like go get a gun and hole up and panic. I'm saying, I think what people are confusing is the difference between panicking and preparing.
Right.
There are preventative measures that you can take. Social distancing right now is the best thing we can all do to flatten the curve, which is what we're trying to do. Flattening the curve means the less of us that get exposed to each other, the less it spreads, the slower it won't be that exponential straight up line that we're seeing in Italy, where everybody was like, oh, don't worry, go about your business. This is just the flu, blah, blah, blah. And now their health systems are overwhelmed. And then what happens when the health systems get overwhelmed is that they can't treat people who have other emergencies. And now every ICU is full. And now they're treating people in tents. I mean, it's crazy what's going on in Italy. And again, this isn't some third world. Lombardy, Italy has some of the best healthcare in the world. And it is like on the brink of collapse. That's not me being hyperbolic. That's actually what they're telling us.
Right.
And they're trying to scream to the rest of the world, like, you guys are idiots. Pay attention to what's happening here, and nobody's listening. They said it's like watching a horror film unfold for the rest of the world, where they know what's coming, and they're like, don't go down in the basement. And we're all like, tra la fucking la. We'll go down in the basement.
Well, so when you say social distancing, what do you mean?
Social distancing is the practice of trying not to there are many ways you can do this, but it's basically putting distance between you and as much of the public as possible. So if you have a family reunion, maybe consider going or consider rescheduling it. If you have an event where there are a lot of people gathered, don't go out for that big dinner. They're talking, I think in Seattle today, they said any event that's over 100 or 250 people should be canceled because there's lots of evidence that this is where these things spread. There was a Biogen in Boston, there was a Biogen conference of 175 people, and 50 people in the conference got it. And now 70 people can be linked to that particular conference. So 70 people from one event. This is why they're saying social distance, cancel parades. There's a great example. Well, not a great example, but there's a story from the 1918 pandemic. And I believe it was a parade it was either St. Louis or Philly. I can't remember exactly where it is. I'll look it up. Anyway, a city decided to have a parade and it was catastrophic. They were told not to really have it in light of the flu, and then it ended up, I think there were 2,500 people who died within a week, and then another 2,000 a week later, like within this parade, and it just spread like wildfire. This thing, as I was mentioning, is just a nasty little bitch, and it's airborne and contact and lives on surfaces. So if you go to, don't go to Disneyland, maybe consider having a staycation for spring break. People who are like, I'm still going to Disneyland. I'm like, you're fucking crazy. And this isn't just about you. This is about your grandma and your parents.
Right.
That's the other thing people don't. They're like, well, I'm strong and healthy, and there's just so much misinformation. It's not the flu. It's not even in the same family as the flu.
Right.
It is, in some instances, 10 times more deadly than the flu in terms of mortality, depending on where you are. And it's also so social distancing is things like when you're standing in line, stand like a foot away from the person. Don't get right up on them. If you're taking public transportation and it's very crowded, don't wait for another train. Give yourself enough time. If you are waiting to get on an elevator, don't get in a crowded elevator. In China, they're not letting more than 4 people get in elevators as they're letting people get back to work. There are just little things that you can do where you make sure you're constantly sanitizing your hands. Try not to touch your face, although that's still like, okay, don't touch your face, but still it's airborne. Yeah.
Well, it's interesting.
What we do now will affect what happens later. If it isn't as bad as Italy, it's because we're taking preventative measures now. Like, that idea of canceling everything is not a bad idea. If I was in charge of America right now, I would say, everyone, stay home for 2 weeks.
Right.
Just chill out and let us get a grip on who exactly has this, where it is, how it's spreading. Like, right now, it's still just spreading casually everywhere.
Right.
And we have no idea who has it or when, because we aren't even testing fast enough to figure that out.
Right.
And I've been saying this for 2 fucking weeks.
Right.
I've been saying for 2 weeks, this is spreading everywhere right now.
You're like, it's out there spreading right now. I can feel it.
I can feel it. Like, it's just... So I think that it's not crazy to say, I'm going to take 2 weeks and chill and play board games and read books and, just slow everything down and try and limit your contact with the public as much as you possibly can. If you can work from home, try and work from home. Again, it's a week before spring break. I don't know why the schools aren't canceling everything. Look, I look at actions and not words. And I certainly don't listen to the pundits of America because they're interested in division. We cannot trust our government right now, unfortunately. And the mainstream media tends to ratchet everything up because they've politicized everything too. I look at the actions of businesses who are losing money because if you're seeing things like Coachella get canceled, that's billions of dollars that they're losing. That's something serious.
Yeah.
Now, it's not like, they're not going to do this because it's hysteria.
Right. They're doing it because it's a legitimate concern.
Yeah. And there's lots of old folks' homes out in the desert over there. So it's not about, that's the other thing, trying to convince people in America that it's not just about them is like you can't, I am blue in the face with people who are like, it's just the flu. It's not going to affect me. I'm like, it's not all about you. It's about protecting fragile people with weakened immune systems who can't protect themselves. Old people do not survive this.
Right. You were saying someone was like, just stop being a transmitter and stop going out and killing people.
Yeah, there was an Italian op-ed in Newsweek today, and it said, oh, you're young and healthy and probably will survive the coronavirus. Good for you. Now stop killing people.
Uh-huh.
It's not just about you. And they're like, well, kids can't get it either. Yes, they can. That's not true. Kids get it. They just don't get it as badly, but they're still little freaking hosts.
Right.
They're like little host monkeys, and they go run and hug grandma, and now grandma's dead.
Uh-huh.
Don't let your kids kill grandma.
Tell us how you really feel, Bridget. It's true. We were having this long conversation before we even started recording, and I was like, we should be recording this because you were all fired up. And there's a huge difference between panicking and being prepared. There's a huge difference between panicking and taking common sense precautions. And the people who are in denial and denying it and are just like, oh, it's just the flu. Oh, whatever. People are being hysterical when there's actually a legitimate threat staring them in the face.
I've been saying this all week. I'm like, these pundits who are telling everyone to calm down are the same people who freaking flip out about a halftime show being too racy or leggings or pronouns and all across the board. And I'm like, you guys are literally the worst.
Yeah.
I don't know how anyone listens to you ever again. And it's pundits they don't have any consequences for being morons.
Right.
They should anyone who's telling you to just act like this is normal and that this is hysterical should like never have any credibility again.
Right.
And I'm not telling people to panic. I'm telling you to go do your own research, your own information, try and learn something from experts who are on the ground. And there are so many people that are out there with huge platforms who are like, what's the big deal? You guys are all panicking. I'm like, you're not a doctor.
Right.
Every epidemic, like all the doctors are screaming until they're blue in the face. This isn't about not getting Trump elected. This isn't about crashing the economy. This is a global problem we are going to have to face together as a species.
Right.
Like, we should be having solidarity right now. That's what the World Health Organization was saying. This isn't about like politics or anything. This is about just trying to minimize the stress on our infrastructure, which we already don't have enough for.
We already know we're unprepared for this already. Out of the gates, we know we're going to be screwed in certain situations.
It's so frustrating to me because there is just this like willful ignorance, and it's even more hilarious to me that the arguments that I'm having with people about this are boomers. I'm like, okay, don't care. Talk to me when your husband is dead of coronavirus.
Right.
Like, or in the hospital on a respirator because you told me that I was overreacting, and I don't even have to care.
Right.
I care because I'm a responsible member of society, and I see that my actions right now are going to affect all the other people around me in my community. My community is a lot of retired people.
Well, you had me watch the Joe Rogan Experience with Michael Osterholm.
Yeah, he was on
doctor.
CNN today too.
Yeah, and all you have to do is watch the first 5 minutes of that podcast, and you're like, you get a sense of like, oh, this is real. This is the gravity of it, and it's it's scary, but it's like also like, okay, there's ways, it's everything you've been saying of ways we can handle it, and it's all about how you choose to handle it. But if you ignore it and are just kind of like, whatever, it's such a commentary on the human, like the way the human mind works, the way we try and like blind ourselves to the threats that are really terrifying.
It reminds me of that book that I have, The Lessons of History, where that famous female historian is like, humans do not care about things. This is the Black Plague book that I'm reading, and she says it about the Black Plague. We didn't care about it until the shit was literally on our doorstep, and until one of these pundits' grandmas dies or parents dies because they like this affects the old the worst, and they are living in highly concentrated populations right on top of each other.
Yeah.
I mean, there was a crazy story. It's hard to get your mind around. I understand it because these kinds of things happen in like slow motion until it's fast motion.
Right.
But there's a boat with 600 scientists studying climate change. There was a great tweet that was like, oh, if you think this is a nightmare unfolding before your eyes, imagine being on a boat studying climate change that intentionally got frozen in the Arctic. And then one person was tested positive on the boat with coronavirus.
Oh my God.
Yeah. And boats are like highly, because it all gets in the ventilators and like it's so bad. It's so bad. The CDC came out and said today, basically, do not go on a cruise.
Right. No, we're dramatically unprepared, and this is going to get weird. And Michael Osterholm, the guy, was like, this is not a blizzard. This is not a coronavirus blizzard. It's a winter.
Yeah.
We need to think of it that way. This isn't going to be over in a few weeks. It's going to be months.
And what is the big point? Like I think the doctor I was listening to from Italy. Oh no, it was the WHO, one of the WHO doctors. They were saying, I'm sorry if you have to inconvenience yourself right now, but what's more inconvenient? You chilling out for 2 weeks and laying low until things, we'll know, because it's exponential, we'll know a lot more. We're 11.5 days behind Italy, according to like all of the algorithms and the models that they've done. And, Britain's 9 days behind them. So everyone who in these countries who's like, well, it's not here yet. Like, you are literally morons. Like, anyone who says that to you, disregard them. They're a moron. Immediately disregard them. Anyone who says to you, it's just like the flu, immediately disregard them. They are not taking people with the flu in bubble wrapped freaking, have you seen the way they take these people into the emergency room? They're in plastic wrapped containers and all three people have hazmat suits on. Like, that's not the flu. Right. I don't know how to express this loud enough. It is not the flu. Stop saying that. It's like anyone who says that is a moron. Dismiss them. They don't know what they're talking about. Go find real information from experts. Like, email me. I will point you in the right direction. I have put everything that I put about coronavirus on Phetasy for open to the public.
Yeah.
Yeah. I'm not putting it behind my paywall. Anything that I find, I put up there. I'm right. Like, I don't know what to tell people because they're literally morons.
They're just willfully ignoring it because they don't want to see it because it's scary.
Yeah, well, okay, but
you're still going to have to deal with it.
And there are things that you can do. You can why wouldn't you be a person who errs on the side of caution and tells people that they should do the same instead of telling people don't panic and go about your business as usual and this is all just hysteria? Like, right. Why would you say that in the face of something that is ravaging Italy right now in ways that you cannot possibly comprehend?
Right.
I don't understand. I do not understand that. Why would you want that in black and white? Even if you're wrong. Okay, I was wrong. I shouldn't have told you guys to chill out for 2 weeks. My bad.
Right.
It wasn't as bad. And again, we'll never know. If we act preventatively, somebody said this is going to be like Y2K, which took an enormous amount of manpower. He was like, I hope this ends up being like Y2K.
Right.
Which was a massive problem that took an enormous amount of manpower to fix. And now we look at it as a joke.
As it was all hype. No, it's because we spotted the problem early and dealt with it.
Right. And now it seems like a joke and an overreaction. That's the problem with when you take preventative measures that work. They don't look like they worked. Right. It looks like you were overreacting.
It's true.
That's the point. So,
but still, there is no downside to
erring on the side of caution. None. There is a downside to running around and acting like this isn't happening.
Yep.
or telling people that they're overreacting. Like, no, you're not right. People are not overreacting to this. Not anyone who's paying attention, not doctors, like not anyone with a brain. And it's not, and then these comparisons that are like, oh, 20,000. There was that great tweet that I read about the bear.
Oh, yeah. That was great.
I love that.
That you put on Phetasy.
I have it right here. I mean, even who today, they were like, we do not use the word pandemic lightly. And we know that this might cause people to panic, but we need people to take this seriously. This tweet, more people die from car accidents than bear attacks. But if you saw a sleuth of bears running at you, you wouldn't say to the bear, cars kill more people. You take that time to attempt some social distancing maneuvers really fast. It's like, yeah, obesity kills more people over the course of a year in America. It's not something that's,
I don't know what to say in the
no,
face
you can't. It's literally moronic. When somebody makes those comparisons, I'm like, you're a moron. You sit at another table. You don't get to be people who are saying those things. I'm like, you get to sit with the kids while the grownups figure out what the fuck is going on. You don't get to be a part of the conversation. And if you are a part of the conversation, I'm not listening to you because you've just proven to me that you're a moron.
There are just certain things that
people say when I'm like, oh, okay, you're a moron. And some people I'm like, oh, you genuinely don't know anything about this. I mean, people who are like, oh, it's just like the flu. It's not even in the same family. It's not even in the flu family. So when you say that right away, you're wrong. And there are people who want more education and are willing to listen. And then there are people who are just morons and don't want to hear you, and they should be ignored. And don't waste your energy trying to convince somebody. Most of these people I ask myself, like, why would you tell people that? I tell everyone, don't panic. Panicking is never good in any situation. It's just not a good reaction to have. But the more prepared you are, the less likely you will be to panic.
Right.
And it's not, people aren't asking for much. They're just saying, like, chill the fuck out for 2 weeks. Try and stay home. Go get, enough food for like 2 weeks and just hunker down. It's a good opportunity to like go slow and read the books that you've been buying from Amazon and haven't read, and listen to podcasts. And that has been something that's been really nice for me because I've already just started doing it, and I live that. It's not hard for me. I live that way anyway. But I've canceled things. I mean, and it's funny too because I'll see a lot of like people in right-wing media in particular, and they're like, "Oh, it's not a big deal." Blah, blah, blah. I'm like, a right-wing media company canceled my trip. They canceled it, not me, because they don't want people flying. They did the right thing. Right. I'm like, good for you.
Right.
You should be taking this seriously, and you shouldn't want someone from California where there's known cases flying into Dallas.
Right.
Where there's nothing. And they're finding TSA agents with it. I mean, the shit's everywhere.
It is. And it's highly contagious.
It's everywhere, and you don't know it. And they're going to start finding out because we just are getting tests online. So part of the reason that the numbers are going to go up so drastically, part of it is bad because it shows how many people have it, but part of it is good because at least it means we're getting online with testing. We're able to like get these numbers in. But we're beyond being able to track this shit.
Well,
there were this is when I knew we were in trouble. Yesterday, I was paying attention. And there were 5 cases discovered in South Dakota, which has a population of like, it's low.
It's
low. And there were 5 people discovered, 1 death, and all of them were unrelated.
Oh, wow.
Yeah. I was like, oh.
Oh, wow.
Yeah.
Yeah.
In South Dakota.
That's bad.
Really bad.
Really fucking bad.
That's bad. That's a small state. They were all in different parts of the state. Like, that's when you're like,
it's
red
everywhere.
flag. Yeah.
It's everywhere.
Houston, we have a problem. Yeah.
Well, we're going to put this check-in on YouTube as well as putting it at the end of the podcast.
And it's going to be titled, You're All Morons, except for the people who are actually taking measures to socially distance and listening to experts and keeping their hands washed and buying toilet paper. That's the other funny thing too, is like the people who are like, hey, don't be all hysterical. Like I guarantee these are the morons hoarding toilet paper, which is an alarmist thing to do. You don't need to punch an old lady over toilet paper. You just need to have enough food so that you can hunker down for a little bit. That's all. All you need to do. If I was in any position to do so with a family or anything, I would say, yeah, we're just chilling out for 2 weeks.
Yeah.
Like, we're just going to hang out. And that is doing our part as a member of society to not spread this stuff.
Mm-hmm.
Do your part.
Well, it might not be titled that because that's really long, but
that's going to be the title. It's I feel a little bit Chinese where I'm like, these are very strange times. Do your part. What are you doing outside without a mask?
Mm-hmm. I'm going to go buy some food. More food.
We bought a bunch.
I bought a bunch, but I need to buy more.
These are very strange times. Yeah, I was fired up. I'm actually very glad that I'm not on Twitter because I would be tearing like 90% of the people that I know a new a-hole because they're literally morons.
I'm glad I have you as a resource, to be honest. You know, like you do go down these rabbit holes. You're always searching for like the source information.
And I'm not the kind to panic. I'm like the last person to panic.
No, you always have very pretty common sense takes on things. And
I don't panic. I'm the person in situations that always ends up in like an emergency situation and everything gets calm for me.
It's true.
It's like when shit starts hitting the fan, everything slows down for me and I'm like, oh, okay, I know what to do.
Bridget thrives in emergency situations.
Maggie's seen it like a million times, like the time that old lady passed out.
That was quite a story. We were at this movie theater and there was some guy came in the back was like, is anyone related to blah 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 lady? And then at the end of the theater, and Bridget had gone to the bathroom, and then at the end of the screening, we all came out and like some old lady had collapsed and there were paramedics and blah blah blah. And of course Bridget walks up and hands her some water and she's like in the mix and involved in it's from the beginning. She saw her collapse.
I was right there.
Dealt with the whole thing. I was like,
and everyone was freaking out and this one lady was panicking and I was like, please step back and give her air. You are not making this better. Like you freaking out. She's fine. She was embarrassed because she had an accident when she fell too. She was really old. So I was just holding her hand and asking, like trying to give her space. I told somebody to go call the paramedics. I told someone else to go find who she was with.
No, you like just handled the whole thing.
Very calm in these situations. And so that's why when this was all happening and I saw this whole debate kind of, out of the corner of my eye on Twitter of like, is this people panicking versus people not, in denial or downplaying it? I was like, well, what's the science? I just started looking at the science and the models and why do we think that it would behave any differently in America as it has in China and Italy and literally everywhere else it goes.
Right.
Like now we're seeing today in Germany, their numbers are doubling and it's crazy how once it gets foothold, it like doubles every day. There could be 1 million people with this in America within 3 weeks.
Right.
I mean, it's if the models, and unless we take like action, and this is what we're trying to prevent, is so that we're not stressing our system. And if this doesn't happen and it's pretty mild and our systems are like fine, and it was just everybody being like they canceled things and chilled out for 2 weeks, then good.
Great.
That's best case scenario because that's not what we're seeing everywhere else.
Right. Well, thank you, Bridget. I feel
welcome.
like I got quite an education today. Now,
yeah. Anyone has any questions, feel free to like email me or reach out. Mm-hmm. I've been really going deep down the rabbit hole on this, and I trust scientists. This is where I trust scientists. I'm sorry.
And the message is: don't panic, but take common sense.
Don't
precautions.
Panic. Be prepared.
Be prepared, and try and know what to do, and try and sort out the real information from the noise.
Yeah. Stay calm. Wash your hands. Stay away from groups.
And ignore the morons.
And ignore the morons. And try and get actual correct information. This isn't people, this is where, and ask yourself what your bias is. If you don't want to believe this, ask yourself why. Mm-hmm. If you want to believe that this is, I err on the side of being prepared always, because as we know, I'm a prepper, but I also err on the side of generally expect, like preparing for the worst and hoping for the best. Mm-hmm. So know your information. But if you're erring on the side of this is not happening and it's not a big deal, ask yourself why. Why are you telling yourself that? And what good does that do you? And what good does that do your community and your society? Oh, it doesn't. You're a moron.